Today we'll discuss some important SATA questions. Let's start with the first one. Which client statement indicates the correct understanding of antiembolism stocking use? So we need to find the true statement here. I will apply them in the morning before getting out of bed. This is a correct statement because whenever we need to put on antiembolism stockings, we put them on first thing in the morning. This is because the patient has been lying down all night. If the patient lies like this, the venous return is good. But as soon as they get out of bed in the morning, their legs hang down or they start walk or stand up, the venous return decreases as a result. So because the venous return will decrease or the veins will dilate, there's a chance of edema. Therefore, we must put on the stockings before that happens, as they are very effective then. So putting them on in the morning before getting out of bed is the correct statement. They should feel snug, but not painful. Yes, snugly means they should fit firmly. They shouldn't be too tight or too loose. I can roll them down if they feel too tight. This is an incorrect statement because our stockings have a band at the top end, a tight band. If we roll them down, it will act like a tourniquet. Now, it won't let the blood coming from below go up. This means it will block the venous return, which is not what we want. I should wear them only when I am walking. Only when I am walking means they're saying they'll only wear them while walking. But this is an incorrect statement. This is because when we walk, our calf muscles naturally squeeze. Squeezing means they increase venous return. So rather than just walking, we need to keep them on even when the patient is immobile. When the patient is lying down or sitting or not moving, we still need to wear them because at that time, the muscles don't squeeze. This means the venous return is very sluggish then, so it's crucial to wear the stockings at those times. A nurse is providing discharge teaching to a client who's been prescribed Warfarin. Warfarin is an anticoagulant drug that works to thin the blood. So it's a blood thinner. We need to find the correct statement. I will use a soft bristled toothbrush. A soft toothbrush should be used to avoid chances of minor bleeding or any minor injury or scratch. Otherwise, the risk of bleeding increases. This is because whenever we give a patient warfarin, it thins the blood. It goes into the liver and reduces clotting factors. This results in fewer clotting factors being produced. So the chances of bleeding will increase from anywhere if there's even a minor cut. After that, I should keep my intake of green leafy vegetables consistent. So those green leafy vegetables contain vitamin K. Now you have to remember this. If it said low or high instead of consistent, then the scenario would change. But here it says consistent, which means we have to maintain a consistent level. So this is a true statement. Now we need to understand one thing. Whenever we give warfarin to a patient, what it does is thin the blood. But when vitamin K reaches our liver, if vitamin K reaches it, then the liver will produce clotting factors. And if it produces clotting factors, it means the chances of clots forming will be higher. If we give the patient too much vitamin K along with warfarin or a diet high in vitamin K, it means more clotting factors will be produced. So now what will happen? The chances of blood clotting will increase, even though we were giving the patient warfarin because we wanted the blood to be thin. So this means given too much vitamin K will reduce the effect of warfarin. This means that vitamin K acts as an antidote to warfarin. So the antidote for warfarin is vitamin K. So that's why we should never give a diet high in vitamin K. Besides that, we shouldn't suddenly stop the vitamin K diet either, because suppose you stop it suddenly or don't give any vitamin K at all while the patient is taking warfarin, then what will happen is that if you don't give any vitamin K, the liver won't produce any clotting factors at all. And if it doesn't produce clotting factors, it means the chances of bleeding will increase. So on one hand, we were giving warfarin, which was already thinning the blood and increasing the risk of bleeding, and on the other hand, the patient isn't taking any vitamin K. And because of not taking vitamin K, the blood became even thinner and the chances of bleeding increased further. This means it will potentiate the effect of warfarin. So you have to remember both things. If you completely stop the patient's vitamin K diet, it means it will now potentiate the effect of warfarin. If you increase the vitamin K diet, it means it will work opposite to the effect of warfarin. This means it will reduce the effect of warfarin, so that's why we have to keep the vitamin K level consistent. There are some diets rich in vitamin K like green leafy vegetables, colored greens, mustard greens, and spinach, kale, and sprouts. All these things are vitamin K rich diets. If I get a headache, I can take aspirin for relief. If the patient has a headache, then aspirin. If the patient is taking warfarin, aspirin should not be given because aspirin is also an antiplatelet. So there are chances of bleeding from it, and there are chances of bleeding from warfarin. So it means there are chances of the patient bleeding. So this should not be given either. I will notify my healthcare provider if I notice black and tarry stools. Having black and tarry stools indicates that the patient has bleeding somewhere inside the GI system. So this means it could be because of warfarin, so the doctor must be notified immediately. This is a correct statement. If I notice bruising, I should skip my next dose of warfarin. Bruising can occur in patients taking warfarin, but the patient should never skip it without a prescription or without discussing it with the doctors. So this is also an incorrect statement. I should use an electric razor instead of a blade. Electric razor, yes, electric razors don't cause injury to the patient while shaving, but a blade razor will cause injury. So this is a correct understanding. Teaching a client with diabetes about sick day management. Which instructions should the nurse include? Select all that apply. The patient has diabetes and it's a sick day. Sick day means the patient might have the flu that day, might have a fever, might have diarrhea, or might be vomiting. So in these conditions, what happens is that it's considered a stressful condition for the body. And whenever the body is in a stressful condition, the patient's body releases stress hormones like cortisol and glucagon. So what will the nurse do? Select all that apply. Check the blood glucose more often. Yes, the patient's blood glucose needs frequent monitoring because it will rise as glucagon secretion increases. It's a stress hormone, right? So the secretion of glucagon has increased, so we have to check the blood glucose level frequently. Stop insulin if not eating. We often get confused here, and sometimes students select this option and their question becomes wrong. Even if the patient isn't eating, what will happen? The sugar level could still be elevated because glucagon has released more glucose into the blood from the liver. So that means if you stop the insulin, the blood glucose level will keep rising even more. Whether the patient has eaten or not, in that patient, meaning a diabetic patient, or even in a normal patient, it increases. If, for example, we are in any stressful condition, our body needs more energy. So glucagon is secreted from our body so that the blood glucose level increases, and then energy is obtained from glucose metabolism. This is a normal condition, but the patient has diabetes. Having diabetes means either insulin isn't being produced already or there's resistance to insulin. This means whatever glucose enters the blood won't be shifted into the cells, and it will remain in the blood. This means the blood glucose level will keep rising whether the patient has eaten or not, because we're talking about a sick day, so this means stop insulin. You shouldn't stop insulin, even if the patient hasn't eaten at that time. Take sips of water. Yes, we should keep taking sips of water during this. If you don't drink water, you'll get more dehydrated, which will also cause problems. So this is a correct statement. Test urine for ketones if glucose is elevated. If the blood glucose level is high, it means the cells aren't getting energy. It starts burning fat, and from fat it tries to get energy. At that time, ketone bodies are produced. And when ketone bodies are formed, they're acidic in nature. This means for a diabetic patient, if ketone bodies are formed and they're acidic, it means the patient will develop diabetic ketoacidosis. So what we call DKA will develop. If DKA develops, it means we have to keep checking for ketone bodies. Stay in bed until feeling better. Stay in bed, but it says until here. So stay in bed until the patient is completely recovered. There's no such thing as needing complete bed rest in this, so this is also an incorrect statement. A nurse is teaching a client with asthma. Which teaching points should the nurse include? Select all that apply. If the patient has asthma, what will we teach them? We need to remember two things about what happens in asthma. Inside the asthma are these bronchi and bronchioles, like these. So in this lung, these bronchi and these bronchioles, the first thing is that their smooth muscles will constrict. If they constrict, it means they will become narrow. The first problem in this is bronchospasm. The second problem is that its lining, the inner one that is, the innermost covering of the bronchi, gets edema or inflammation. So the second problem is inflammation. And the third problem is that there will be more mucus secretion here. If there is mucus secretion, it means the airway will have less room for air to go inside. So we have to keep these three things in mind. Now let's do it. So when we give inhalers to the patient, two types of inhalers are given. One is a rescue inhaler. A rescue inhaler works in emergency conditions. It relaxes the smooth muscles. Because of that, these bronchi will dilate. If they dilate, it means more room will be available. The airway will open. Whereas besides this, we give a controller inhaler. These inhalers are steroids. They work on the lining of the bronchi, reducing the inflammation inside. So you have to remember both things. Now let's solve the question. Carry a rescue inhaler at all times. Yes, a rescue inhaler, meaning it will immediately dilate this bronchiole and the patient will get relief from the wheezing they were experiencing. In rescue inhalers, for example, mostly consider albuterol or levobuterol, which are rescue inhalers, so the patient must carry them at all times. An asthma attack can happen at any time, so use it. Use the steroid inhaler before the bronchodilator. See, the rescue inhalers we had were bronchodilators. They were dilating the bronchioles. But here it says to give the steroid first and the bronchodilator later. That shouldn't be done. It's a wrong statement, so this will be incorrect. Because first we have to give the patient the rescue inhaler or bronchodilator. What did it do? It dilated this. Now there's more room. Now we have to give this patient a preventative or controlling inhaler. So that includes things like steroids, any of those that we can give to the patient. Because after that, we'll give the steroid inhaler, and then the medicine inside will easily reach all the way to the end. It'll reach the end. That means it'll go inside and easily treat the inflammation. It'll reduce it well. So in this option, they've given the patient the steroid first, which is wrong. We never give the patient the steroid first. Stop inhaler once symptoms resolve. You should never stop the inhaler like that without a doctor's prescription. Rinse the mouth after steroid inhaler use. Yes, whenever a steroid inhaler is given to a patient, the mouth must be rinsed well afterward. Because when we give steroids to a patient this way, meaning when they inhale it, there are chances of oral thrush developing in their mouth because the local immunity there weakens. Because of that, the chances of oral thrush or oral candidiasis developing are higher. So this is a correct statement. Use the rescue inhaler daily for prevention. See, for prevention, we use a preventive inhaler or a controlling inhaler, which includes steroid inhalers like budesonide. But the rescue inhaler mentioned here acts as a bronchodilator. It doesn't work for prevention, and there's no need to take it daily. It's only taken when the patient has wheezing or, an asthma attack, or as the doctor prescribed. But it's not used for prevention, so this is incorrect. Which clients are most appropriate candidates for SCD therapy? Select all that apply. SCD stands for Sequential Compression Device, meaning a device that compresses in a sequence. It inflates, then deflates, then inflates again, so there's compression happening inside in a sequence. That's why we call it an SCD, or sequential compression device. This is mostly given to patients to prevent deep vein thrombosis. It's used for patients who are immobile, where there's a risk of clots forming in the veins of their legs, so we use it in those cases. Now, which patient is suitable? A postoperative client on bed rest. Since they're on bed rest, the patient is immobile, so we should use an SCD for them. A client with active deep vein thrombosis. Now, this is a bit of a trap that often catches people on exams, because whenever a student sees deep vein thrombosis, they think we should give the patient an SCD to prevent further thrombosis. But that's not how it works here. You also have to notice that it says active. Whenever you see active, it means the patient already has a thrombosis. Now, after this, if you suppose there's already a blood clot or thrombosis in the vein of the patient's leg, and then you apply an SCD, which is a sequential compression device, it will compress. After compressing, it will push that clot further up, and it could reach the lungs. The patient will have an embolism. So we don't use it for this patient. That would be wrong. A client with limited mobility after a stroke. Yes, if a patient has had a stroke and their mobility is reduced or they can't move much, then we would use it. A client with severe peripheral arterial disease. We won't use it for that because peripheral arterial disease is a disease of the arteries, not the veins. It means the artery is insufficient for delivering blood. The arteries can't get enough blood to the periphery, meaning the legs. They can't reach the feet. They can't provide a sufficient supply. Apply a device like an SCD compression device, it'll compress even more. So what happens then? The supply of oxygen and nutrients to those tissues was already low because the blood supply in the artery was already reduced. If you squeeze that leg even more, the supply will decrease even further. So for peripheral arterial disease, we won't use it. If it were a venous disease, meaning a problem with the veins, we could use it. If venous return was low, but here it's not about venous return, the arterial blood supply is what's reduced. So we won't use it for this. A client recovering. Now look, it's spinal surgery. This means the patient might have limited mobility, so we can use it for them. Before applying sequential compression devices, which assessments are the most important for the nurse to perform? Select all that apply. Assess skin integrity of the lower extremity. Yes, check if there's any breakdown in the skin or if the circulation is low. This needs to be checked. It's correct. That needs to be checked because if there's any disease related to the arteries, then we won't apply the sequential compression device to that patient. These sequential compression devices are applied if venous return is low. They aren't used for arterial issues because if the artery is already reducing blood supply and then we compress it with this device, then the blood supply to the tissues further down will be completely cut off. That's why we need to check if the patient has any arterial, meaning artery-related disease, so this will also be correct. Confirm the client has intact sensation. You have to confirm if the client has sensation, whether it's intact or not. It's not necessary for sensation to be intact when applying SCDs because, for example, if a patient has a spinal injury, they won't have any sensation in their legs. And if they are immobile, we can still apply SCDs. So having sensation is not necessary for applying SCDs. This is incorrect. After that, obtain baseline blood pressure. Checking blood pressure is also not that necessary. A nurse is caring for a client with heart failure. Heart failure means the heart is not pumping blood. The heart cannot pump as much blood as it should. Which findings indicate worsening heart failure? Select all that apply. This means which condition indicates that the heart failure condition is getting even worse? Weight gain of 3 pounds in one day? Yes, if there's a weight gain of more than 3 pounds in a day or 5 pounds in a week, it means the heart failure condition is worsening. So this is correct. Whenever heart failure occurs, the heart cannot push the blood. Then fluid starts collecting inside the lungs. If fluid collects in the lungs, it means crackles will develop in the patient. This happens in left-sided heart failure. This is also correct. If there are crackles, it means the heart failure condition is worsening. Increased urine output. If urine output is increasing, that's actually good because we need to get the fluid out. So this isn't a worsening condition, making it incorrect. Yes? If the vein is becoming more distended, it means the patient's heart isn't pumping well, so the heart failure condition is worsening. That is, these veins will remain distended. This is a symptom of right-sided heart failure, so this will be correct here. 88% oxygen saturation. This means the heart's condition is also deteriorating here. Heart rate is 58 per minute. Is that related to worsening heart failure? There's no direct classical sign of a low heart rate here, so this will be incorrect. And orthopnea, yes, if the patient has orthopnea, we can say that fluid is starting to collect in the patient's lungs. This means the heart failure condition is worsening, so this will also be correct. A nurse is assessing a client who has recently had an arteriovenous fistula created for hemodialysis, which finding indicates that the fistula is patent and functioning properly. So an AV fistula has been created to perform dialysis on the patient, so how can we say the fistula is patent? A palpable thrill present over the fistula. Whenever we palpate the fistula, we feel a vibration from there as blood passes through it, which we call a thrill. So if a thrill is palpable, it means blood is easily passing through. That means the fistula is functioning and patent. A bruit is auscultated over the fistula. Whenever we listen to it using a stethoscope over this fistula, we hear a sound, a whooshing sound, which we call a bruit. If a bruit is present, it means the fistula is patent. The skin over the fistula is warm with good circulation. Yes, if the skin there is warm, it means there's good circulation. The client reports severe pain at the access site, which is the AV fistula site. If the pain keeps increasing there, it could mean there's an infection or perhaps an occlusion within the fistula. This means the fistula is no longer patent. The hand distal to the fistula is cool, pale, and has diminished pulses. Let's say the fistula is made here, and the part of our extremity beyond it is cool, pale, or the pulses are low or diminished. It means that fistula likely has some obstruction. This means it's no longer working properly. So here, it means this fistula is no longer patent. Capillary refill in the fingers of the affected extremity is less than 3 seconds. If it's less than 3 seconds, it means the capillary refill is normal. If the capillary refill time is more than 3 seconds, it means we could say that the circulation is reduced. Whenever we need to check capillary refill, we compress this nail bed like this. We keep compressing it until it turns white underneath. Now see, it's completely white, and then we release it. So, turning pink again, that is, if this area turns pink again in less than 3 seconds, if it turns pink, then we can say that the blood circulation is good. If this 3, if I kept it pinched, after a while, as soon as it turned white and I released it, if it's turning pink after 3 seconds, it means the blood circulation is not good now. So we also need to see this. So here the refill time is normal. This means the fistula is working. A nurse is assessing a client who's experiencing hyperkalemia, which means the potassium level is elevated. The normal potassium level is 3.5 to 5 milliequivalents per liter. So this means the potassium level in this case will be more than 5 milliequivalents per liter. Which findings should the nurse expect? Select all that apply. That is, whenever a patient has hyperkalemia, what will be the findings? Muscle weakness. So you need to remember one thing. There are 3 types of muscles in our body. One is smooth muscle, one is skeletal muscle, and one is cardiac muscle. So potassium affects all 3 of these. In skeletal muscles, remember that whether it's hypokalemia or hyperkalemia, in both cases, the skeletal muscles will be weak. This means skeletal muscle weakness is something we will see. After that, peaked T waves on the EKG. Potassium's role is in repolarization, so because of that, the T wave will become tall. And if the potassium level is low, the T wave will either be short or absent, and an extra U wave will be formed. The ST segment will be depressed, so that happens in hypokalemia. In hyperkalemia, the T wave will be tall. Hypoactive bowel sounds. Now from here you have to see that our bowel, that is our intestine, has smooth muscles in it. So hypokalemia and hyperkalemia both affect smooth muscles in different ways. How? If there is hypokalemia, then the activity of our smooth muscles decreases. Peristalsis will decrease. This means the patient will develop constipation. But if the patient has hyperkalemia, meaning the potassium level is elevated, then the activity of the smooth muscles will increase. So let's see here. Here the patient has hyperkalemia, which means the activity should have increased. Peristalsis should have increased. But what do we have here? Hypoactive. That means our bowel is less active. This means this is not an expected finding. So this will be incorrect. Hypokalemia will cause bradycardia in the patient. Hyperactive deep tendon reflex. When this deep tendon reflex becomes hyperactive, meaning it increases, this is mostly seen when calcium levels are elevated. That is, in hypercalcemia, not in hyperkalemia. Flaccid paralysis. Flaccid paralysis means if the levels increase significantly, the patient's skeletal muscles will become weak. Because nerve conduction is also affected by potassium, it means the patient will experience flaccid paralysis. Ventricular dysrhythmia. Yes, potassium is essential in a patient for the heart's conduction system to function well. That is, to keep the conduction system in the heart proper, a normal level of potassium is necessary. So, if it's not normal, ventricular dysrhythmia will occur. A nurse is caring for a client who's developing acute left-sided heart failure. If the patient has left-sided heart failure, which assessment findings should the nurse expect? Meaning, we need to identify the signs of left-sided heart failure. Select all that apply. Crackles in the lungs, meaning if there's left-sided heart failure, because of that, our blood will back up. It'll back up and go into the left atrium. From the left atrium, after that, congestion will increase in the pulmonary vein area. And then, within the capillaries inside the lungs, due to increased pressure, fluid will start shifting into the alveoli within the lungs. So when air passes through there, a sound is created which we call crackles arouse. So crackles in the lungs? Yes, that's a sign of left-sided heart failure. The condition of orthopnea is such that when a patient lies down, they immediately experience breathing difficulties. So what happens? Normally, when the patient is standing, all of their blood is in the legs due to gravity. But when the patient lies down, as soon as they lie down, that gravitational pressure decreases because the legs are now horizontal. So venous return will increase, more blood will reach the heart. Now the heart won't be able to pump it, so it'll back up into the lungs. If it backs up, pulmonary congestion will increase further. So at that time, the patient will have breathing difficulties. So the patient will immediately stand up. By standing up, it means less blood will reach there now and the patient gets relief. This condition is seen in left-sided heart failure, which we call orthopnea. Jugular vein distension. Jugular vein distension is seen in right-sided heart failure because from the right side, from the right atrium, it backs up. So distended jugular veins are seen. Pink frothy sputum. Pink frothy sputum is also a feature of left-sided heart failure. Oxygen saturation 88%. This is also from the left side. After that, hepatomegaly. Hepatomegaly is a feature of right-sided heart failure. Dyspnea. This dyspnea is a feature of left-sided heart failure. So these were the SATA questions. See you tomorrow in a new lecture. Thank you.